For the pain, it's an uncomfortable procedure. No matter who does it, it is uncomfortable. But I think that if a patient has a very good explanation of what's going to happen as it happens, it takes away that element of fear. And I think there is a lot of apprehension and anxiety around having a painful procedure. And if that's going to the dentist, some people get very upset about going to the dentist. But if you've got a really good dentist who talks you through it, you relax, you have it done, you leave and you think, well, that wasn't so bad. And the same thing applies to painful procedures like bone marrows. If you can explain to the patient, it's going to hurt when I put the local anaesthetic in, but that will settle after a couple of seconds. It's going to hurt when I first take the sample of the aspirate out, but that will then settle in a couple of seconds. I think it's the surprises that you do to people when you just suddenly do something and they're, oh, wow, that hurts. And then they expect it to continue to hurt. But if you can explain each stage very carefully to them, perform that stage, and it meets their expectation, this is going to hurt, it's going to be very painful for a few seconds, and then that pain will go, they trust you. They will know that the next bit that you explain to them is going to be okay, and they relax a bit more. When the patient is very tense, it's very difficult. It just makes the whole procedure more difficult. We use local anaesthetic within the skin to anaesthetize the top layer of the skin. I'm very fortunate in that I've been able to introduce Entonox gas, so patients use that to breathe with, and that's a direct analgesia, and it works to bring down their levels of anxiety because they know that the pain is better controlled. It's controlled by the patient themselves, so they hold the tube and they breathe that in nice and evenly, and it gets them through the procedure. There are some patients that that's not even strong enough for, and we have to use alternatives. So something like intravenous Midazolam, which again makes them less anxious. It has more side effects, so we don't use it as frequently, but we reserve that for those patients that are just so anxious, no matter how well you explain it to them, they cannot get through the procedure, and we have to do something to try and bring down that anxiety and relax them even further. So there are options available. We can do a bone marrow on pretty much anybody. Sometimes it takes a little bit longer with others. You can have a nice quick procedure, it will take you 5 minutes. Somebody else might take you 30 minutes to do it by the time you've gone through everything in great detail for them.